She expressed to me that she did not want to live anymore, and she had been cutting, and just, I knew in my body, I could feel in my body that this wasn't a threat.
Angela Pickowitz assertively, tenaciously reached out for help for her 14-year-old daughter. She came up empty. She estimates she called 75 psychiatrists, psychologists, and therapists in a 50-mile radius.
Their voicemails just say, "I'm sorry, I'm not accepting new clients," or you call and they say, "I'm sorry, but we don't deal with that age range."
Angela says the cutting, the despondency, the suicidal thoughts all emerged during the pandemic. She describes her daughter pre-pandemic as vibrant, athletic, engaged with the family, who suddenly started sleeping more, withdrawing.
It's my belief that the length that this has gone on has made a tremendous impact on their mental health.
Angela's daughter was admitted to a New Hampshire hospital into what's called the Annex. Angela says 8 other children were also in the Annex in mental health crisis. It was a week-long holding pattern until a mental health facility had a bed available.
There's no place for these teens who are feeling this way. And it's a scary place if you've never been there. Why aren't people talking about this like they're talking about the coronavirus? Because it is that big.
Parents aren't the only ones ringing the bell. Teachers are seeing it too. The technical savvy to flip to remote learning was as simple as 2 + 2 for Ms. Gauvain's students. It's the emotional social component that stalled, and the deficits are apparent already.
Just in terms of socializing with each other, it's almost like they've forgotten what it means to talk to another person, and how do I identify what that other person is feeling, and how do I approach that person if I can't fully identify what their emotions are.
Educators call it social emotional learning and say ideally it happens in person and closer than 6 feet.
We encourage them to talk about it, because a big part of social emotional learning is being able to express your feelings in a way that others will be able to understand it and in an appropriate way.
There have been across the board reports of increased stress, anxiety, and depression, particularly across the lifespan, but particularly hard-hitting youth and young adults.
What is surprising and hopeful is that preliminary CDC data for 2020 reveals a decline in suicide rates. Ken Norton is wary of celebrating the decline too soon, but one theory is that mental illness is part of the everyday narrative surrounding health. Talking about it is less stigmatized, and that is a win. Norton says keep the conversations flowing with open-ended questions.
What are you looking forward to? What are you not looking forward to? Well, what have you missed the most during this past year by working remotely? What do you think you've done well? What do you think you haven't done well?
With summer vacation right around the corner, Ms. Gauvain has an assignment for parents. Seek out ways to get kids outside with their peers and even a change of scenery.
Any chance that they have to go somewhere else in terms of a road trip, any form of safe travel, a safe summer camp, anything that they can do to socialize, especially during the summer, is what these kids need.
Angela Pickowitz says her daughter is doing well now and has a weekly therapist appointment. She wants mental health to get the attention that COVID has been grabbing for a year and a half.
My plan is to do something to help change this. I wouldn't voluntarily ever send my child there. There's no other resource. There's no other place. There's nothing else you can do.
Amy Covino, WMUR News 9.